So, welcome to another podcast with me, Alyssa. And today I'm joined for the very beautiful blonde bombshell that is Magda. I will let her introduce herself and what she does.
So, hi everyone. So, I'm Dr. Bejma, and what I do is my background is GP. I'm also do medical aesthetics, and I'm an expert when it comes to feminine wellness.
And where is this gorgeous accent from?
Poland.
Right.
Yeah, mixed between Yorkshire, Leicester. Where else did I live here? So it's about 20 years I've been in England. So yeah, it's mixed with a bit of like.
So you grew up in Poland. Mm-hmm. Is that where you did your medical training?
Yeah, I did medical training back in Poland. So 6 years. I have never worked in Poland before. So literally finished medical university. During uni, I used to do some like electives here. Mm-hmm. Then I fell in love with a British guy. I'm married to the Polish guy, by the way, now.
Oh, right.
and I followed the love. That's why I came to England. Obviously, me being here a few months and we split up.
Yeah.
And so I decided to stay, finish the training because I actually enjoyed that. So
yeah.
And yeah, this is how I am. I'm here now.
Oh, wonderful. So your background is in general practice, so you're a GP.
Yeah, I worked for about 10 years as a GP. I don't do any more NHS. I stopped about 2 years doing the NHS.
Right, okay. And now you just focus on women's wellness and making a woman feel beautiful on the outside.
Yes. So I have like an aesthetic clinic. So we do all sorts of injectables, but we are medical aesthetics. So we deal holistically with it, also focusing on health, women in wellness, like supplements, other stuff. So it's not purely just, as someone will call, anti-wrinkle injection or lips. It's not just all about that.
Yeah,
it's really holistic approach.
Yeah, you can't just come into you and say, right, I want loads of Botox and filler. Or you can do, but you offer so many more packages and like treatments and procedures than that as well, don't you?
Yeah.
Yeah, I mean, we met because I did a women's wellness event and you were also showcasing there as well. And then I think, if I can say this, you are one of my customers now.
Yes, I am.
You're an Elle-Sera golden girl.
Yeah.
How are you finding the experience?
It's great. I have to be honest. I'm always very skeptical when it comes to any sort of supplements because I think it's as you are being medical, you have to have like almost proper prescription, isn't it?
Yeah.
So you didn't know I'm taking it, isn't it? So I usually, whenever I introduce something to either my followers or to my patients, I test on myself. So when I revealed, actually, I like this pill, golden pill, it was 3 months I was taking it. So I was like absolutely amazed. I was thinking like, oh my God, this actually works. So I absolutely love it. So yeah, it's really good.
Oh, well, that's lovely to hear. And I'd like to say, like, people often think like when I invite a guest on and then like, then they have to speak about my product favourably, but that's not actually true. We met, you bought the product off your own back, you started using it, and only then after you'd used it for 3 months, did you actually contact me and tell me that you actually had been using it for 3 months.
And I like it.
That you really liked it. And then I was like, oh, well, that'd be brilliant. Be love to like chat further.
Yeah.
And
because we quite clicked at the event as well. You did a really good show. And then you were surprised what actually I can do for feminine wellness. So we almost felt like there is a link.
Oh, absolutely. Yeah. And I thought my customers would love to hear this. So one of the things we were just talking about before the podcast started was the non-surgical labiaplasty.
Yes.
So, for anybody who doesn't know what a labiaplasty is, what is that?
So it's, I would say, aesthetic procedure, and obviously it's for women.
Yeah.
When you will see your labia minora is sometimes a bit bigger or hanging, asymmetrical. So girls say that usually just, I don't like how my labia minora are looking.
Yeah.
And they're looking for a surgical procedure where they normally just cut a bit of skin.
Yeah.
We now have a device in England that's been introduced about sort of 3 months ago. And the procedure is called FemTite.
Okay.
And using very high radiofrequency energy, we can actually provide results very similar to surgical labiaplasty with no scarring. So it's absolutely amazing. And women do regain the confidence again because it's, as I said, it's not really a medical condition. It's more to do with the aesthetic.
It's aesthetics, okay.
But if you, in your mind, you just don't like the way your vagina looks, your vulva looks, then you're not confident this will affect your relationship, then you're not wanting having sex, you're not enjoying having sex. So it's lots of implication, and it's not just simply like, oh, I don't like how my vulva looks. so much implication for my patients.
Yeah. And then, so is it like a laser?
Yeah, it's similar like a laser. It comes like a sort of V. So one part of this device go inside the skin and the other stay outside. And because high radiofrequency energy, it will cause the labia to shrink. So we're not really cutting anything off or anything, that they just sort of shrink.
Okay. So would it go like wrinklier, or does it just like tighten the skin?
They tighten the skin, so that we are aiming to tighten the excess of the skin.
Right.
Procedure is under local anesthesia, really quick, about half an hour. And you can go back to your normal sort of like life, next day. Don't need really time off from work. One of my colleagues who was a nurse, she had that because she was a model for it to sort of give us really good feedback. She was back at her work in a hospital next day.
Wow.
It's absolutely amazing. It's nothing like surgical.
And how expensive is that? Or not expensive? How much does it cost?
So this is really depends. If you really need like a significant fixation, let's say down below, it could vary from anything from 1,500 to 3,000.
Yeah.
Obviously, if you do it in Leeds, it's a bit cheaper. If you're doing Harley Street, because at the moment there are only 4 doctors in England doing this, including myself.
Wow.
Yeah, it's fairly new.
That is new technology.
There is so many new technologies for women's wellness that I'm so excited, and I'm so happy that we talk more about what we really need.
What about one of the questions that I see a lot is like after pregnancy, I've just had a baby. Thankfully, I was okay. I didn't get any like, pelvic floor issues or anything like that. Apart from having an emergency C-section after like a 2-day labor, it was pretty okay. But for women who maybe do have multiple children, the pelvic floor can be ruptured or it can cause issues. What could you do for that?
So there are lots of things I can do for that, starting just simply from internal treatment with radiofrequency to improve pelvic floor. We've got also like a muscle stimulation that is like a tiny probe we insert and is stimulating muscle to make them stronger.
Right.
There is so many technologies to improve your pelvic floors, because the truth is, once you had a baby and the damage being done, and at that stage you will start to do all your pelvic floor exercises, chances are there won't be, to be honest, any or very minimal improvement. And the reason why I'm actually in that field as well, when I worked as a GP, I used to just end it. That was quite upsetting, because I ended saying to all these female, you had a baby, it's normal. You cannot go on trampoline. Probably all your friends cannot go on trampoline.
Yeah.
So it's almost sort of like a normal.
Yeah.
But it's partially because I love NHS, don't get me wrong, but it's partially how NHS is in this country. This is like urinary incontinence, leakage after having babies, multiple pregnancies, as you said, is sort of almost considered normal.
Yeah.
Patients coming to my clinic, they are 35 and wearing pads.
Yeah. And they don't feel like confident or like sexy or And
the frustrating part is they will say, oh, Magda, I went to GP and they said nothing can be done. They did give me examination, obviously, to check that there is no pathology. And I was told, like, I've got weak pelvic floor, go to do exercises. And this doesn't really work.
No.
And so it's really, I think what I really love to do is just bring awareness to the female that there are actually treatments available. And other treatments, obviously, because we started from this which is more of the aesthetic treatment, like non-surgical labiaplasty, but any other treatments are far more affordable.
Yeah.
They start from like £100.
Yeah.
So it's really women do not know that there are services to improve.
Well, I didn't know until I met you. I was literally like blown away. And I remember one of the key takeaways from that event when I got back to the office and I was speaking to Kelly, I was like, did you know that you can have like vaginal rejuvenation? Like you have filler in your face, you can have filler down there. And I was like, what? Like I hadn't got a clue. But I suppose maybe I'm not of the age where I would have a clue. But I know that it's not really spoken about a lot. And I was like, oh, I feel like I'm on the cutting edge or something here. Let's talk about it.
Yeah.
So as we age, we lose collagen, we lose elastin all over our bodies.
Exactly.
So
not only the face, when you said it, you might not be this age, but I'm sure you're doing some preventative treatment to your face.
I am, absolutely. I have all I do is Botox twice a year. That's it. But it is preventative, isn't it?
Exactly.
But I'm not doing anything down there.
But you're losing exactly same amount of the collagen and the skin. I don't want to say it, but it starts to get laxity issues as well.
Right.
And, when I was talking at this event about vaginal filler, they called the cereal. It was really, I think lots of people were really like, oh, wow, is there something to help? But I think women don't realize, again, going back to the aging, losing collagen, losing laxity. So, we have the labia majora, so your bigger lips down there, to protect your vulva, to protect the entry to the vagina. So if they lost laxity, and that's almost it's like open exit to the to your vagina. I always that might be really weird comparison, but I would say it's almost like sleeping with your mouth open. So you almost like you got it. They actually,
and then you got more bacteria.
You get dryness. This is where that stems from, the dryness, because the labia majora, they're not really playing the function they're supposed to. So it's not really just like the beads getting floppy. No, they actually, that's why when you said previously on your other podcast about vaginal dryness, everything is linked.
Yeah.
But people don't know. So I love this comparison to sleeping with open mouth, because people are like, oh, I got it. This is so isn't it?
Yeah. And then, I mean, how does that treatment go down? So if I came in and said, right, I want some vaginal filler.
Yeah.
And where do you put it? Like, so the outer lips.
So it's the outer lip.
Okay, so in those bits, and I want them plumping out. Is it just like getting lip filler? Is it like...
Is it similar?
We're going to use 0.5. You only need a bit of 0.5. Or, do you get... You know how women like have overinflated lips? Do they want overinflated?
No, they don't. And we don't do it. We cluster this again as a medical procedure. And no, we don't overfill them. No. Although, in my career, as when I'm doing this, I had some weird requests.
I can imagine.
No, listen, you don't need them bigger, they fine. But
you get some like weird fetish or something.
I know.
Or somebody wanted some absolutely massive labia majoras.
I know. Some women like when they're visible through the tight leggings, we're not going to...
Oh, really? They want that camel toe? Because I'm like, spend my life trying to get rid of that.
I know, same. Yeah. So, you need to be very diplomatic and everything. I said, no, this is enough. But also what I look is a functional. So I don't want to cause the issues as well, because, you exercise, you walk, you sleep, having sex. You cannot really have that overfilled. But it's simply like, small injection, you numb, I numb you for it. So it's very comfortable. And literally just inject. Usually it's like one syringe each labia, so 2 syringes in total. And that is, unless there is a significant volume loss, that is sort of like something that is sufficient.
And then how long would that last?
Last about sort of good 12 months. 12, 18 months.
And you just keep going back for top-ups?
If you need to. Because it's not like at 12 months everything magically will disappear. You will notice that because we're not really stopping the aging process. So on top of what we already put in, your aging process is going ahead. So there is a more volume loss. So sort of just keep up. It's like a maintenance treatment.
Yeah, of course. Yeah. Okay. Wow.
Interesting.
It is so interesting. It is so interesting. And it's good that you're so open and honest about it, and I'm glad that that's like kind of what you led with it at that event, because, I bet there's some women who absolutely hate the sight of what they see down there. And I bet that does have a big impact on the relationship and confidence.
It does. And like, I don't know, my clinic, I think we have at least like probably 5,000 registered female.
Yeah.
And they come and simply we put some leaflets out. We obviously in our bathroom you have like some posters like, do you suffer from vaginal dryness, etc. And I would say at least like 2-3 times a day, obviously women, when they come to the clinic, they usually, I just need to go to the toilet, I'll be with you.
Yeah.
As they do. Stress incontinence, isn't it? The urge, as we are female, which is not normal as well.
Yeah.
And that this can be treated. But they go to the toilet and like, Magda, there is this poster.
Yeah.
What do you mean? You can treat this. There is something you can treat. And it's like, not very painful. You can fix this. I was like,
yeah.
People just don't know.
No, well, technology is amazing, isn't it?
Absolutely.
Nothing ceases to amaze me, to be honest.
I know.
So with the pelvic floor tightening, so that is like a probe that goes in.
Mm-hmm. It's a magic wand.
Yeah. I have actually seen these. I think it's on the Real Housewives of Cheshire. I think somebody had it done.
Yeah, she did it, isn't it?
Yeah.
I really appreciate how open she was.
Yeah. So it was like a probe that went in and then...
It's heating up inside.
It heats up. And then is it painful?
No, it's not painful at all. Everyone is relaxed. I've got lots of people that actually work on a laptop when I do the treatment or do something.
Oh, really?
Yes.
And how long does it take?
It's about 20 minutes. Right. It's really quick. It's just as you will have for your like a baby ultrasound or any ultrasound, internal ultrasound, it's just a gel.
Yeah.
So you don't need numbing. And the only thing you feel is the heat inside.
Yeah.
And usually first a minute, two is a bit awkward, but I think you guys stressing more about, oh, I'm there, she's gonna do something to me and look at my bits. But after that, which is usually just very good laugh, fun, or if you have to work because you at your break or something, then it's such a comfortable treatment.
Okay, well, that's good to know.
Yeah.
And then radio frequency, obviously, I actually don't know what radio frequency is. I hear it banded about a lot, in terms of like facial rejuvenation and stuff.
So
and I feel like
I
should be having these treatments,
yeah.
like even if it's on my face and stuff.
You can have like for your face, superficial one, really nice, heating up.
And what does it do?
It's basically because there is a bit of like a thermal damage, it's boosting collagen and elastin.
Right.
So it's doing exactly the same internally, stimulating collagen, elastin and improving blood flow.
Right.
And that's really important because when we do this, when I treat my ladies for, let's say, very weak pelvic floor, what they often say to me, and I don't really advertise this as a treatment to increase like sexual or like a sexual sensation, but actually what I would call a side effect is whenever the ladies that have like internal orgasm, they say, Magda, it's like 10,000 stronger.
I bet, because if the blood flows there, this is one of the reasons I put beetroot in Elle-Sera is because it's a vasodilator and it can get the blood around the body.
Exactly.
That was actually one of the main reasons I put that in there. But you have to get blood flow to the area.
Exactly. And
male or female. Women do get boners as well. Things expand as you get sexually aroused, and you should be blood flow should be flowing in a great direction and down to your genitalia.
Oh my God, my patient would love speaking to you, honestly, because this is how I explain things to them, like benefits and like blood flow.
Yeah.
And when you say things like that, such a simple language, and I think this is what also like medical services lacking, simple language to the patient. So it's amazing, but absolutely more blood flow, more sensation, better orgasm.
Yeah.
As simple as that.
Yeah, absolutely. Okay. So what are your most popular treatments when people come in to see you?
I would say usually they start from something that is less invasive.
Okay.
So we're looking at the magic wand, what I call Forma V. So vaginal radiofrequency is the most popular. You need treatment of 3-4 weeks apart, and then it's like a maintenance once a year.
Right.
Definitely far most popular. And
then how much would that be if I wanted a course of 3?
It's 1,500.
Okay.
For the course of 3.
And then if... say I've got no problems. Would there be any benefit from me having it?
Prevention.
Yeah.
Because remember, you will start to see issues when there's a significant damage.
Okay.
So, you are aging there and we're all aging there. And, your body is coping and everything, because you said you're quite fit going to the gym. So, but lots of my ladies, even 30, they cannot lift the weights, anything, because the weak pelvic floor. But that usually is later stage. It doesn't start like that. So with you, it will be the prevention exactly the same as you do your Botox.
Right.
So you won't need 3 treatments as a booster to start with because you're not symptomatic.
Yeah.
But at least try to schedule like a 1 a year. So sort of as a preventative rather than, because when I said it's 3 treatments 4 weeks apart, that's more like a treatment schedule. Yeah. But for someone who wants to just look after...
If I want to take my vagina to the gym,
then
okay. Exactly. I feel like I literally...
You just want to have it.
I feel like I have just come from the gym, right? And I literally spend my time in the gym looking at my back all the time. I carry weight on the back of my arm. I'm absolutely obsessed with losing the weight off the back off my back and the back of my arm and seeing definition, right?
Oh,
and
it's amazing.
And it is popping through now after consistently 3 months of training now. And I know I've had a baby, be kind to yourself, all that, great. But there's, I'm of the belief like, no, let's go. I can make this happen. So I spend my time doing that. So now I'm thinking, well, yeah, I need to be working that out as well. Do you know what I mean?
It's true. It's actually
even
true.
if it's just one workout a year, then
yeah, I think if you obviously enjoying also sex, and you're thinking like, okay, I'm gonna be 55, and I want to enjoy sex as much as I enjoy now, you definitely need to have to start looking into something just to prevent as well, because whatever we do, aging, we can slow it down, but we cannot stop it. So
no,
and we know we age the same, collagen, elastin down, and with us female, when our estrogen goes down.
Yeah, of course, estrogen, testosterone, of course, you get. I mean, I'm a big believer in testosterone or products that are going to kind of like lift your own testosterone, which is what Tribulus does in our product. It really helps you free testosterone levels. That's why I always take it before the gym. It gives me way more energy, more mental clarity.
This is what I found after taking it.
Pushes me hard. It really pushes me harder. Like, I'm not even going to be big-headed, but I was throwing those weights around today. And even my PT said, this is the best you have ever performed in here since you started.
Amazing.
And I was just like, everything is working at the moment. Like, I'm sleeping well. Like, everything's kind of like in synergy.
I might need to assess your like intimate health.
Exactly. So I'm thinking maybe I need to be doing something for my intimate physicality.
Exactly. You see how it's like weird to sort of say about this, isn't it? Like, how we even say that?
I know, but I'm trying to be like PC or like kind of like not too crude with the language that I use, because I know the way. I know the way I could say it if I was talking to my friends on WhatsApp.
I know.
But I wouldn't want to say that on the podcast.
How often, because obviously you are having this podcast and everything, but this is what we had the chat before that, obviously we started podcast. It's like, how often do we actually talk to our friends about it? No.
Hardly ever. I think people are a bit more embarrassed about it. Yeah.
No.
It's unusual. Like, women don't talk about like masturbation. Women don't talk about their sexual desire. They certainly don't really talk about it with their friends unless they're quite liberal. It's not really spoken of. And if you're a younger generation, you speak about it a little bit more. But the older generation, I can't imagine my mum's generation talking about it. And then my grandma's generation, I can't imagine them talking about it. And they should. I mean, I do know some couples who are really like fun loving, and they're probably in their like 50s, 60s. They are like really in love couples, still like, at it, love it, you know what I mean? And they're absolutely fabulous. They talk about it a bit, but hardly ever, and that's quite unusual.
Yeah. No, I went with my friend. We went this weekend, and obviously her dad is obviously no name, so I can say it. Is like 68, and obviously mom is a bit younger, 64, and she came to me saying, Magda, can you advise me something? My mom said that is having a bit of issues. What can that do? But they wouldn't like go and talk to like even doctor there or anything. And then so mom told daughter, and obviously because I'm a doctor and I'm a bit in this industry as well. So I started talking to them about Viagra and everything. But it shows like people, honestly, no matter, 60, 70, people want to have nice and healthy sex.
Yeah.
So that's why start prevention and looking after your feminine wellness early on is so important. And especially if you had a baby, and if you were, I would say, a bit unlucky and things are not as they should, let's say, bit of leakage, very tiny leakage when you start with very small pad, then because this won't improve. This just will get worse.
It will always get worse.
Exactly. So just simply start as soon as possible. And sadly, how the system is, you probably will have to look into more private services at the moment,
Yeah, I would imagine it's not the first port of call to keep, I would say cancer treatments and, and things that probably...
and the heart, heart attacks, everything.
Yeah.
And, I agree. But also I think what is missing part, like I remember me being in this position, as I said, I worked as a GP for 10 years. I didn't have anywhere to direct them.
No, exactly. So even on a private level to say, listen, I get nothing to tell you this, but off the record, here is a bit of advice.
Exactly. Yeah, absolutely.
I mean, as a GP, could you even give that advice, or would it look like...
I could, yeah.
Could you?
And then I used to do it when I discover that time when I used to just search for one of my good friends, mom, some sort of help with the menopause, then I did search, and then like I felt like absolutely fine, and patients actually appreciate honesty, saying, I'm really sorry, I don't think like NHS can actually at the moment help you.
Yeah.
But you know, if there are any fundings or anything, and you'll be surprised how many people actually got private insurance as well.
Yeah.
So it's just knowing that there are services.
Okay. Yeah. Apart from the vaginal rejuvenation, then obviously we have a lot of ladies who go through menopause, and they all want to look good. We use this platform to talk about everything. Last week we had a hairdresser on who was talking about hair and what happens to your hair during the menopause and getting older and how to keep it beautiful and healthy. But what would you say is like a great protocol for your face, would you say?
So I would say, again, is prevention. So any laser treatment, I don't know, do you guys heard about Morpheus 8 or...
I've heard about this, never had it, looks great. A lot of people rave about it.
It's great. This is one of the devices we really highly rate at the clinic, and it's absolutely amazing. Again, really high stimulation of collagen and elastin. So again, skin thicker, looking younger, tighter, bit of lift. And anything like biostimulators to hydrate the skin. And the most important, wear your SPF, honestly. It's just really simple. I think it's the cheapest advice to give. Daily SPF. I wear every day SPF 50. Even that I'm not really outside or there is no sun out, is the best sort of prevention, because we know the sun is one of the biggest factors responsible for our aging.
Yeah, not just on your face, but on your neck too.
Everywhere.
I'll put like factor 30 all over my body, but on my face and neck, especially here, don't want a crepey neck.
No.
I put factor 50.
Yeah, and that's good. And that's why when you're going to keep your skin nice and you're looking younger for longer.
Or a big hat. Or be like Joan Collins and don't even go in the sun and just have fake tan.
But it's kind of difficult. You've got kids, I've got kids. So you have to play with them. So sometimes it's difficult. Like, you know, my patients sometimes, because I'm a bit tan now, obviously we had some holiday. People are like, oh, you tan. Like saying it to me because I keep raving about like using sun cream. I said, I'm really sorry. I had to go and play with my kids in the sun.
Yeah.
But it's sometimes inevitable, but you can do as much as you can about reapplying SPF, and it's easy.
Yeah, absolutely. No, that is a quick win, cheap and easy. And I read a report the other day that was in the Daily Mail that Asda SPF came out one of the best.
Oh, wow.
Yeah, like £4 it was.
So no excuse now.
One of the best.
Yeah.
Like so good.
Yeah.
I was like, wow, that's amazing. And great PR from Asda.
Amazing.
Yeah. So, okay, so Morpheus 8 is a laser.
It's a radiofrequency microneedling. So the needles go through your skin, and then, I know, a bit scary, but you are numb for it. And then there is a radiofrequency, so heat under the skin. So again, as we discussed, similar sort of like treatment for the vagina, because you will be shocked, and it's not much out there yet, but there is actually Morpheus 8 for vagina as well.
Come in.
No, it's actually in, and I have it in a clinic.
Oh, wow.
And you'll be surprised, because like people often say like how the facial Morpheus, it can be uncomfortable. Actually, internally, I know that sounds cruel, but me as a female, I can say that internally it's not very sensitive. So when we do this treatment, it's actually very comfortable.
Right.
So I use that treatment, internal Morpheus 8, it's obviously different handpiece.
Yeah.
So for the face looks like a gun.
Yeah.
For internally, it obviously looks like a bit of probe.
Okay.
Another magic wand.
Yeah.
So it's really good, and it's for a bit for more severe cases, more of the problem of the mixed urinary incontinence, more severe laxity issues, and like lack of sensation. So that really works better as well.
And what about how many times do you need to do Morpheus 8? Is it a course?
Your face? Yeah, it's a course. And again, let's say you are in great shape, okay? Looking at your skin, you're doing everything. Again, you don't need to jump and start to have it 3 treatments. But let's say, you know, you're 45, 40, between around 50. Obviously, your estrogen already going down. Then we recommend to having 3 to start with, and then yearly maintenance. But as soon as you start, you know, as you know, estrogen starts to go down around 30, 35. So if you time this with some form of prevention, so at least 1 Morpheus a year, it's absolutely amazing. You're just gonna keep this healthy, glowing, tight skin for a lot longer.
Something else.
You're going to have a list by the end of the
I'm going to
podcast.
absolutely have no money left, okay?
Who needs money? Great sex is better.
Oh, God, yeah, I wish. I was like pricing up a driveway last night and I was like, it's going to cost what? Oh, my God. It's so expensive. And I'm thinking, this is just a driveway. Wow. Bricks and stone. Wow.
Yeah.
Not even anything like cool, you know what I mean? Like a cool couch or something. Okay, so Profilo is something also I have never done, but I'm quite interested in.
You need to have it
everywhere. God, my bill's getting big here. So Profilo, what is that?
It's an injectable.
Okay.
It's a biostimulator, stimulate collagen and elastin, give him nice glow, and it's very high dose of hydration. And that's something that anyone will benefit. And if you are after like nice, healthy, glowing skin, have it. Add to the list.
Really? And where would I have it?
Face and neck. You can have on your body as well. Let's say if you've got a bit of creepy skin on your arms or around the knees.
So it's just like a plumper, really? A bit like hyaluronic acid?
Yeah, it's a hyaluronic acid.
Right, okay.
But it's a form of like a biostimulator. So it's not really filler. So it's not going to make bigger cheeks or, it cannot be really injected in the lips, but it's not enlarging any part of the face. It's just hydrating.
It's just hydrating.
And it's a biostimulator. So stimulate collagen, elastin, slowing down the aging.
It's a wonder how anybody gets through the day without this stuff.
I don't know. I just don't know.
I mean, you look beautiful. Do you do all these things yourself?
No, obviously I don't inject myself because I don't like needles.
Right.
I can inject you. I can do all the treatments. But yeah, I'm sort of like, I had some fillers. Like last time I had a lip filler about 18 months ago, 2 years ago. And then I get Botox because I love Botox. Like, don't like looking grumpy, angry. Yeah. But other than that, my obviously perfect skincare, I love retinol, everything, SPF, but it's lasers. Everything what keeps me in shape is a laser. Yeah. So you name it, obviously you've got Morpheus 8, CO2 laser, which is good for the skin quality.
So CO2 laser is, for anybody who doesn't know, is a bit more invasive, more very aggressive. It literally resurfaces your skin, doesn't it?
It gives you like a nice baby skin.
Right, but it's quite intense.
It's
I've seen some people after it and their entire face has dropped off. Like literally it is burning your face off, but the results in about 2 to 3 weeks
they're amazing,
is unbelievable. But it's like a real big resurfacing.
It is quite big resurfacing, but you need to know is something that you can adjust the settings, depends on the indication. And there are people that love like being like everything burn me and then like lock themselves in a house for 2 weeks. But if you can achieve exactly same result on a lot lower settings and having 2 to 3 treatments, and you can just work as normal, go to work, not really locking or covering your face with mask or anything, but it's purely adjustable. And like, because most of my patients, they having very busy lifestyle, similar like mine. Yeah. Then all over recording podcasts, TV, etc. They usually go for a low setting, but a bit more frequent treatment.
Right. Okay. Yeah, that's a way to get around it. If you don't, if you haven't got the downtime, then that'd be a lot easier. It does appeal to me, but I think I'm a bit young for it yet. Maybe when I'm about 45, I thought I might have and I'm 37 at the moment. So, no, I have my Botox twice a year. Although I've noticed since I've been going to the gym a lot more and weight training a lot more, it's wearing off well quicker.
It will.
So I'm like now getting more crow's feet back. So I'm thinking I might have to up it to 3 times a year. Yeah.
But it's sort of like, it's recommended almost like every 4 months. So you just falling into that group as well. Yeah. And it is, if you're lifting heavy at the gym, you are pulling the faces. Yeah. So, you're like, oh. Yeah. So you almost like forcing all the muscles. Yeah. You almost training them to get stronger as well. So, fighting the Botox.
Yeah, you're right. You're absolutely right. Okay, well, I have learned a lot today.
You've got a long list of treatments.
I have got a long list of treatments. I don't know how I'm going to afford it all. Because last night I was sat looking at like nose jobs and stuff, and I was like, oh my God.
Stop it. You don't need it. You're so beautiful.
Oh my God, I do. I look at it and the baby now she's getting like a bit bigger and she's moving around a lot more. Yeah. She's hit me in the nose so many times. And I'm like, oh my, it's the point where I've got tears in my eyes. And I thought, oh my God, I'm bleeding. Do you know what I mean?
Yeah.
Like, shit. If I didn't need a nose job before, I definitely do now.
Wait, if you're going to have another one, just wait. Another one will
Yeah.
kick you in as well.
And then I really have to get my pelvic floor done.
You do. Yeah, I know.
Oh, well, this was interesting. Thank you so much for coming to chat to us. And thanks for being a great cheerleader to Elle-Sera. And
it's absolutely fabulous. Gold bill.
If anybody wants to get in touch with you, where can we find you? Your clinic is in Leeds, isn't it?
Yes, it is in Leeds. And we have website is www.drbejma.com. And
Bejma spelled
Bejma.
Yeah.
Or you could go on the Instagram and just type Dr. Bejma, again, Bejma, and you're just going to pop up. So, yeah.
Amazing. Well, you're a great advocate for what you do. I love that you are so on board with women's wellness, and I'm sure we're going to have another chat again soon.
Oh, amazing.
Thanks for coming.
Thank you.
Thank you.
Thanks. Bye.